what are the chances of people in this population without a vaccine having moderate, severe disease or death? Is it so minuscule that it really doesn't make sense, even if the vaccine was available, to take the vaccine?
So Timothy, here's my take. If you had vaccines, in this utopian idea of unlimited resources, if you had vaccines, you want to prevent any risk. So if you were to compare the risk of adverse events due to vaccine versus taking the vaccine, we do normally a cost-effective kind of analysis. Taking the vaccine makes sense. But here's the issue. 18 to 45-year-olds are about 63% of the population. That's where the bulk of our population is. Those who are above 45 years are about 35% of the population. Right? Now, if you look at the disease or the deaths, 88% of the deaths have happened in people over 45 years. There is a 12% of the deaths that have happened in younger people, but this is among the 600 million people who could have developed the disease and death. And if you look at the infection rates, infections happen to everybody. Infections, in fact, happen more to the younger people because we are out, up and about, we travel around, we are likely to catch the virus. Having given all of this a thought, the risk, what we look for is something called the infection fatality ratios. Very different from case fatality ratios. So case fatality is when you have symptomatic disease, what is the chance of someone dying? Versus, if you have picked up an infection, what's the chance of you first becoming symptomatic? And then, having become symptomatic, what's your chance of you dying? So there are two probabilities involved here, right? And the answer there is for the extreme, actually the 18 to 20-year-olds are the ones at the lowest risk in that set of picture. So, but even there, if you look at a country like India, you will have 5, 10, 15,000 deaths in that population. Huge numbers for a young population. But remember, the denominator there is about 600 million people, right? Are those lives valuable? Yes, they are. So we, in public health, use something beyond emotion. We try to look at this, dispassionately, and we use a terminology called number needed to vaccinate. The number needed to vaccinate to prevent a death, right? So if you vaccinate 100 people to prevent one death in the older people, you need to vaccinate about 1 lakh people in the age group that you're talking about to prevent that one death. Now that takes you to the next question. Is the death of a 60-year-old more valuable than the death of or less valuable? And those are very difficult questions to answer. So I won't go there, but I'd say that in the current situation where we have about 100 million doses of vaccines so far, and our capacity to build vaccines is about 100 million per month at this point, till newer firms like Zydus Cadila come in and others come in. Both Covishield and Covaxin put together is about 100 million doses. We will need, just for the older population, at this rate, 9 months to complete vaccinating. And now bring in the 66% of the population, which is almost twice as many people, at much lower risk, and ask for vaccines. You're going to start competing. You're going to compete for that same little resource that is available. And that's the real dilemma. So when vaccines were offered to healthcare workers, we all went through this question. At my age and with my risk profile, do I need the vaccine? Should it go to somebody who is more at risk? And some of us waited for a while, and then when others had stopped taking it for various reasons, hesitancy and otherwise, and vaccines were available, we went in and took the vaccine. I'm not saying this is the role example that people have to take, but to recognize that the risk is limited, risk is extremely small, developing severe disease, particularly in the 18 to 25 age group, and saying, let's wait, let others get it first. And then once the supplies become more, getting it would be the approach that I would recommend. And this is not based on just trying to be nice and magnanimous. It's just cold rationale that those people are at much higher risk, and them being good actually protects us as well. This whole equation would have changed if these vaccines were transmission blocking. That means if you got the vaccine and you wouldn't get disease, you would also not transmit it. It's hugely important then to give it to children and to young adults, because they travel all over the place, they pick up the virus, they bring it to the older people in the house. Protecting them would make a huge difference. This happened in influenza, it happens in other diseases. Vaccinate the children, the older people are protected. Unfortunately, these vaccines don't work that